Good morning, Peter Goertz. I'm a psychiatrist. Getting off psychiatric medication, that can be a tricky issue, can be very desirable for some people, and let's talk about different aspects. I'm thinking of two different patients, well, multiple, but two different ones crossed my mind recently. One of them got off Abilify, the other one got off Prozac, and ultimately, unfortunately, neither one did well as of the last time I heard about them. So one thing to consider and be aware of is generally or often it takes a while for psychiatric medication to kick in. And it also can take a while, so to speak, for psychiatric medication to kick out. So the psychiatric medicines, let's say SSRIs, can take a while to build up in your system, but also quite some time to build out of your system. So what I'm saying is the SSRIs, let's say, can take 4 to 6 weeks to fully kick in for depression, anxiety. But also if you've tapered off an SSRI, even after 6 months or so, you may be blindsided by deep depression, unfortunately. So that's something to think of, that we have to be patient, really be alert, and over time look at what's going on, how people are feeling. And another thing that I find very impressive is that people are very different. And I'm thinking of one lady who got off not a low dose of Klonopin without any problem at all. She'd been on it for years. And I said, probably, we were talking about her stopping it potentially. And I said, it might be a good idea. And she just stopped it without an issue. No problem at all. So I think she cut it down, tapered it, but still quite briefly, quite quickly, and did well. So it's very interesting to me how different people are, how different their metabolisms are. And it's something really to be careful with, because another person could have had huge problems getting off the Klonopin. Philosophical issues can be important. Some people are fine with the notion of taking medication. Other people are entirely opposed to it philosophically. They just do not like the notion of them taking any psychiatric medication. Short-term withdrawal symptoms, for example, with SSRIs are dizziness, nausea, vomiting, agitation, insomnia, feeling like you have the flu. And the worst offender of the SSRIs is Paxil, because it does not have an active metabolite. So the half-life is about 24 hours, there's no active metabolite, and then the withdrawal symptoms can kick in quite viciously. Other medications that can be difficult to get off of are the SNRIs, Effexor and Cymbalta. They can really bite you also, unfortunately. Benzodiazepines, if you taper them too quickly or stop them abruptly, can cause tremors, seizures. Depakote, basically any drug that can be used as an anti-epileptic, if you taper it too quickly or stop it abruptly, that can cause seizures. So Depakote withdrawal can cause seizures, Lamictal withdrawal can cause seizures, any anti-epileptic withdrawal can cause seizures. Antipsychotics, if you stop them abruptly, could potentially cause nonspecific symptoms, nausea, diarrhea, headaches. And another issue that can be very tricky, let's say with Xanax especially, because Xanax acts so briefly that it causes its own withdrawal. So you take a dose of Xanax and then it wears off, the effect wears off after a few hours, and then you feel very anxious, and it could be from wearing off of the Xanax, just the withdrawal of the Xanax, or it could be the original anxiety again. So that can be quite confusing, and it can be like a vicious cycle. So that's a tricky thing with Xanax. And analogously, or it's a different type of medicine, but with SSRIs and SNRIs, if someone gets off an SSRI or off an SNRI, and let's say after a few months, feels very anxious or depressed, what is going on? Is that the original so-called illness, depression, anxiety coming back? Or is it a longer term effect from getting off of the effexor or the, let's say, whichever SNRI was or whichever SSRI was. So very tricky issues, and depending on what you think is going on, then you may want to restart the SNRI or not. If you think it's still protracted withdrawal, you may want to ride it out as best you can. And again, people have such varying sensitivity to withdrawal of medications. It's unpredictable from what I've seen clinically over the years. Another tricky thing is, let's say, if someone's getting a conventional antipsychotic and that conventional antipsychotic may be masking symptoms like tremor or dyskinesias. If you taper off or stop the conventional antipsychotic, those dyskinesias may come out much more forcefully. So what's actually happening in those cases is you're unmasking the underlying dyskinesia that the medication was masking while it was being given. Bottom line, if you want to get off psychiatric medication, realize it's a journey and be patient. Do things gradually with the help of a psychiatrist whom you trust. Other aspects that can help are psychotherapy, yoga, tai chi, acupuncture, meditation, focusing on a good diet, exercise, making sure you have fun as much as possible, recreation. Basically, trying to make sure your nervous system is as balanced as possible. Thank you.